Autolysis is the breakdown of cell and organs through an aseptic chemical process caused by intracellular enzymes. Soon after death, the cell membrane breaks down with the release of cytoplasm containing enzymes glycolytic, proteolytic, lipolytic. The enzymes auto-digest the tissues even in the absence of bacteria. Modification. Since it is a chemical process, it is accelerated by heat and slowed by cold. Weakens. Organs rich in enzymes, glandular tissue will undergo autolysis faster than organs with a lesser amount of enzyme. Pancreas autolysis earlier than heart and spleen. Dead fetus in utero. There is a septic environment. Autolysis result in maceration of the fetus. Gastric mucosa autolysis causes softening and rupture of the stomach and lower esophagus. In intracranial lesions, when the person lies comatose for long period, this process may start even after death. Putrefaction is due to fermentation by bacteria after death. The bacteria flora of the GAT is spread throughout the body, producing putrefaction. Silent features commencement at a cellular level. Putrefaction begins immediately after death at a cellular level, but these changes are not visible grossly. Visible changes. Putrefaction usually visible externally after rigor mortis has passed off. In some cases, however, visible changes may commence before rigor mortis has passed off completely, cause bacterial enzymes derived mostly from anaerobic organism from the intestine, mainly Clostridium belchi. Others are bacteria aerogens, bacteria capsulators, bacteria coli, proteus, staphylococcus, streptococcus. Entry point of bacteria, GAT most common respiratory tract, genital tract open wound. Spread of bacteria is through blood vessels. Enzymes from other sources are fungi, penicillium aspergillus, and insect in larva or mature stages. Effects. Lecithin produced by Clostridium belchi plays an important part. It hydrolyzes the lecithin of cell wall and RBC, causing postmortem hemolysis. There is progressive breakdown of soft tissues including protein, carbohydrate, and fat. Factors favoring the growth of bacteria. Decreased oxygen concentration of tissue, increased H plus ion concentration, protein, carbohydrate, and fat of body act as a excellent culture media. Staphylococcus and streptococcus may multiple more than 100 times in blood and tissues of corpus kept at room temperature. Taphonomy. Burial nomos to deal with the study of decaying organism over time. Forensic taphonomy is the use of process associated with the cadaver decomposition in the investigation of crime. Example to estimate post-mortem interval, post-burial interval, and locate a clandestine graves. Putrefactive changes may best be studied under three heading: external phenomena, internal phenomena, and skeletonization. External phenomena. Chief external phenomena of putrefaction are color changes, development of foul-smelling gases, color changes, greenish discoloration of the right area fossa. Earliest sign of putrefaction most clearly appreciated in fair-skinned people than in the dark-skinned. Time occurs in 18 hours in summer and 36 hours in winter. Mechanism. Just below the right iliac fossa lies cecum. It lies very superficially. Its contents are fluid in a fluid state and full of bacteria. They migrate out and break up sulfur-containing amino acid, cysteine, methionine to form hydrogen sulfide, which combines with the hemoglobin to form a sulfur hemoglobin, which is green in color, which is greenish in color, causes deamination of phenylalanine, produce ammonia and phenyl pyruvic acid, which combines with iron ferric to form a green complex. An additional mechanism in areas gallbladder is diffusion of bile pigments around. Internally, this changes is seen in under surface of the liver, which is in direct contact with the transverse column. With the passage of time, greenish patches start appearing in the other parts of the body too. They are first scattered but later combined together, so the entire body becomes greenish black. The body may turn almost black in later stages due to combination of hydrogen sulfide with ferrous iron from Hb to form ferrous sulfide. Marbling is greenish brown staining of superficial veins. Mechanism. Putrefied bacteria spread most easily in a fluid medium, tend to colonize the venous system. Hemolysis of RBC release hemoglobin, which combines with the hydrogen sulfide released by bacteria to form sulfur hemoglobin, which stains the walls of the vein, especially over neck, shoulder, chest, root, and other limbs, sides of abdomen and thighs. This gives rise to a barbelled appearances. Linear branching pattern resembling branches of a tree to the body. Time 36 to 48 hours. Skin macerated like appearances as reddish green. 36 to 48 hours. Macerated like appearance reddish green in 3 to 4 days. Dark green or almost black, making your appearance of a gangrene, but it can be differentiated easily. Poisoning by antimony, orange color, marbling. Difference between putrefaction and gangrene. Pus formed in gangrene, not formed in putrefaction. Phenomenon postmortem, that is antemortem. Inflammation and repair, not in putrefaction, only in gangrene. A line of demarcation between living and dead tissue present in gangrene, but none of all tissues is dead in putrefaction. Area all over the area in putrefaction, gangrene localized. Development of a foul-smelling compound. Chemical process in putrefaction are those of reduction. Proteins and carbohydrates are reduced to simpler compound amino acid. Methane, carbon monoxide, carbon dioxide, hydrogen sulfide, mercaptan, ammonia, pH 3. Many of these gases are inflammable. They can be ignited. Okay, these gases may give rise to pre-natural combustion. Foul smell from a cadaver is mainly due to decarboxylation of the amino acid ornithine and lysine, which yield carbon dioxide and foul-smelling foul-smelling ptomaines, that is putrescine, NH2, CH2 NH2 and cadaverine. This breakdown occurs also in living people under certain circumstances, as in bad breath and bacterial vaginosis. Cadaver dogs discover hidden bodies by smelling this ptomaines. Effect of gas. Blisters form because of collection of gas between epidermis and dermis. Postmortem blisters. Fluids and liquid fat may pushed into blisters must be differentiated from antemortem blister. Blisters first on areas where tissue contain more plasma due to hypostatic edema. Back, lower surface of trunk, thigh, etc. Time of development in summer. Postmortem blister. Several postmortem blister on lower trunk also seen. A large blister can be punctured and spread on the table. Pathology 36 to 48 hours. Winter in 48 hours. Bloating surface features may more marked when the head of the cadaver is in most dependent position. Accumulation of fluid. Appearance quite similar to that of strangulation. Eyes softened, may bulge from a socketed lips, swollen and discolored tongue, blackened and thrust between the teeth. Face swollen and discolored, identification becomes difficult or even impossible. In late stages, face is transformed into a bulbous green mass, blood-stained fluid from natural orifices and wound. Due to gas formation in blood vessels, they burst. Wounds may start bleeding, postmortem bleeding or purge. Blood start oozing from nose and mouth. Another cause is gas forming in the abdomen. Diaphragm is pushed up. Lungs and heart are compressed. Rarely bleeding from other orifices. Also anus, ear, vagina. Blood is frothy due to presence of gas bubbles, differentiating from a true antemortem bleeding. In true postmortem bleeding, associated injuries would be absent, resulting outpouring of blood is decomposing. Legend of Antwerp. When coffins are opened after some time for some reason, a number of perfectly well-examined in postmortem cases strengthen the belief that corpus may be actually undead who moves around during nights and feeds on blood. These are blood around the mouth, gardening teeth made more prominent by retraction of lips due to drying. Growth of hair and nails, soma's movement, which seems to indicate that corpus has been moving. Okay. Resistance of a remote surgical incision may occur, which may be mistaken for antemortem injury, leading to an incorrect suspicion of foul play. Artifact of decomposition. A man with a history of colon cancer and substance abuse was found dead. There were advanced putrefactive changes and a multiple defect of the anterior torso that resembled a stab wound. Subsequent investigation revealed that 11 months earlier he had a laparoscopic assisted colon resection that involved surgical incision corresponding in location size to the above defect. Distension of abdomen occurs because of collection of gas in the intestine 12 to 18 hours in summer, 1 to 2 days in winter. On opening the abdomen, gas escaped with a loud explosive noise. Postmortem bleeding from the nose. Please note that marbling over chin and upper part of chest and swelling of eyes. It is a case of hanging. Dried ligature mark can be seen over the neck. Tongue is slightly protruded. Dilatation of anal canal and vagina may appear like a case of a genuine antemortem or vaginal penetration sexual assault. Artifact of decomposition. Distension of a breast genitalia. Breast penis scrotum may become swollen and stiff. Emptying of heart, blood is pushed out, blood for analysis not available in the heart. Expulsion of fetus from uterus, a postmortem delivery may be seen in pregnant woman 2-3 days. Rigor mortis of uterus may be seen an additional reason. Expulsion of the urine and feces in 2 to 3 days due to formation of gas and relaxation of the sphincter. Floating of body in body in water in round bodies. Formation of gases cause the body to come up and float. Postmortem aspiration, gases in the stomach force the food up in the throat, from which it may fall into larynx. Differentiation from a true antemortem aspiration, food not found beyond the bronchi in postmortem aspirate, while in antemortem aspirate it will be found up in a terminal bronchioles. Okay, in antemortem it will be found up to terminal bronchiole. Shifting your position of a postmortem staining. 36 to 48 hours. Postmortem staining displayed in any direction. Position of a body immediately after death cannot be ascertained if body seen at this stage. Skin slippage, epidermis become loosened and separated. Skin of hands and feet come off in a glove and stalking fashion. Exposed subdermal tissue gives rise to giving a yellow parchment-like appearance. Fingerprint can be taken from a skin deprived of epidermis. Cells, sutures of skull, especially of children, separated with a flowing out of liquefied brain for 3 to 5 days. Soft tissue become crepitant, entire body swells due to collection of gas in the tissue. If a suitable area, say chest, is pressed, the crepitant collection of gas can be felt. Feels like a sponge. Swelling of entire body may make even in a thin body appear obese. Microscopically, breakdown of the vessel walls and the cell membrane leads to water lodging of tissue with a protein-rich fluid. This helps in the growth of the bacteria. Other changes, the cornea becomes white, flattened or compressed 12 to 18 hours in summer, 1 to 2 days in winter. Fingertips become leathery and wrinkled. Nails become prominent. 36 to 48 hours body fat, especially omental and mesenteric, liquefied into translucent yellowish fluid. Loosening of appendages, loosened. Temperature, rigor, lividity, decomposition can be easily pulled out. Hair, nails, 4th day, 5th day, teeth. Postmortem luminescence. Body may start emanating light in the dark. The light comes not from the body but from luminescent bacteria, photobacterium fishery and fungi, Armillaria mela. Fissures or split may form in skin. May simulate antemortem incisor wound or laceration. Artifact of decomposition. Miliary plaque. These are small white granules which are seen on a serous or endothelial surface of the body, pleura, endocardium, pericardium, peritoneum. Size 0.5 to 1.5 millimeter. Consists of bacteria, calcium salt, endothelial cells. Fat may be confused with miliary tuberculosis and some inflammatory lesion. Artifact of decomposition. Okay. Appearances of maggot. Maggot appear in 1 to 2 days. They have proteolytic enzyme and penetrate the skin rapidly. This allows air to enter underneath the skin. More maggots enter the body cavity. Activity of maggots may increase the body temperature to above that of normal body temperature. Decomposition and maggot activity to increase the temperature of the body may produce small round hole which may be confused with firearm wound. Internal phenomenon. Internal decomposition proceeds more slowly than at the surface. 36 hours. Inner surface of the vessels are discolored reddish brown, especially the aorta, due to hemoglobin released from RBC, which stains the wall. This is the early ester internal putrefactory chain. 36 to 48 hours. Clotted blood become fluid. Fluid blood start collecting in serous cavity. Such effusions are usually less than 100 ml. In death due to drowning, similar effusion will be there, but they would be much more in quantity, several 100 ml. This is due to passive using of the drowning medium through the lungs and visceral pleura in the pleural cavity. 48 to 72 hours, viscera may be discolored dark red to greenish yellow, greenish blue, greenish black, and finally black. They are softer, greasier to touch. 5 to 10 days, collicative putrefaction begins, abdomen burst, stomach and intestine protrude, thorax burst, especially in children, may be confused with the genuine antemortem trauma. Tissues become loose and soft, converted into a thick, semi-fluid black mass separated from bones and falls of body fat, especially mesenteric, omental, and perirenal liquefies into translucent yellow fluid which fills the abdominal cavity between the organs, marked in obese people. Cartilages and ligaments are softened towards the final stage. Miscellaneous in ruptured ectopic pregnancy, small fetus may be completely disappear. Order of putrefaction, general rule. Softer the organ, the more blood it contains, and nearer to the sources of bacteria, it is a faster it putrefies. In general, organ shows putrefaction change in the following order: larynx and trachea, brain of infarct, stomach, intestine, spleen, omentum, mesentery, liver, adult brain, heart, lungs, kidney, adrenal, bladder, esophagus, pancreas, diaphragm, blood vessel, gallbladder, skin muscle, tendon, prostate, virgin, uterus, bones, larynx, trachea. Time of putrefaction begins in 24 to 12 to 24 hours in summer and 2 to 3 days in winter. Changes initially mucous membrane become brownish red, then greenish, later softened. Brain, in fact, changes are same that of adult, putrefy earlier than that of adult because of thinness of skull bones and presence of fontanelle. Stomach and intestine. Time putrefaction start in 24 to 36 hours in summer, 3 to 5 days in winter. Dark red irregular patches involving whole thickness of the wall, first seen on posterior wall, later on anterior wall. Gas blood form in submucous layer which project a small multilocular cyst of varying size into the lumen. Later they become softer and dark brown, finally change into a dark, soft, pulpy masses. Mucosa appears as macerated, can be easily peeled off. Diffusion of blood occurs into the tissue underneath the mucus. Subsequent alteration of hemoglobin. Mucosa assumes a brownish color, subsequently becomes greenish, black, and finally black. Intestine almost similar changes. Additionally, there will be, when there is bile in the urine, it passes into the wall and stains it. Spleen 1 to 2 days become soft and pulpy. 2 to 3 days liquefies. Omentum and mesentery putrefy earlier if loaded with fat, become grayish green or dry in 1 to 3 days in summer, somewhat later in winter. Liver timings are more for summer. In winter, some changes take place twice the time. Soft and flabby 12 to 24 hours. Multiple blisters for 24 to 36 hours. Honeycomb liver. Clostridium velci collected in tissue. Spaces in characteristic small clump produces gas which is soon increase in size. Resulting lesions first appear as a small opaque gray, yellowish green dendritic figures in parenchyma. Later form bubbles making liver look like a honeycomb. Form E liver, honeycomb liver, vesicular liver, colon initially greenish, later gold. Black in early stages, discoloration is seen around the branches of the portal vein. Newborn liver appears earlier in newborn children than in adult. Gallbladder putrefies much later than a liver. Brain becomes soft and pulpy, so soon turns into grayish fluid, flows out of removing of the skull. Heart soft and flabby, appears dilated, may show miliary plaques. Lungs at first pale red spot of varying size on the surface of the lung. Later gaseous bullae are formed under the pleura. They are small, red, and scattered, joined together subcutaneously. Later the lungs collapse and become soft, assume a dark bottle green color, finally reduced to small black mass. One pale red spot of varying shape, gaseous bullae. Later the lungs become collapse, soft, assume a dark bottle green color, finally reduce a small black mass. Kidneys. Renal tissue become flabby, surface appears dull and paraboled. Cortex darkens initially, later become green. Adrenal cortex softened from within, forms a core around the softened medulla. Later medulla liquefies. Interior of gland appears a narrow slit as well as a wide cyst-like cavity. Bladder, if empty and contract, resist putrefaction. For a long time, urine may show albumin due to transudation of serum protein from blood within 20-48 hours after death. Esophagus with standard putrefaction for a very long time may be recognized long after stomach has disappeared due to putrefaction. Pancreas, one of the most vulnerable organs to postmortem autolysis because of the action of its own enzymes, initially soften and become hemorrhagic. Later may become hemorrhagic pancreatitis. Differentiating feature: histological changes on necrosis positive Absence of inflammatory reaction and necrosis. For necrosis, diaphragm, putrefied late may be seen in muscular and aponeurotic structure distinguished up to 6 months after death. Blood vessels. Blood vessels, especially large arterial trunks, resist putrefaction for a long time. Arterial aorta has been recognized in buried body even after a period of 1 year. Gallbladder resists putrefaction for a long time. However, bile pigment diffuse early through adjacent tissue, causing green coloration. Skin, muscles, tendons. Reaction of muscles, alkaline during life and supravital pit acidic during rigor, alkaline again during putrefaction. Prostate, virgin uterus. Prostate in the male and virgin uterus in the female are the last soft organ to putrefy. Many a times, sex can be determined in a highly decomposed body by identifying this organ. Gravid uterus or uterus just after delivery putrefies fast due to high water content. Bones, last organ to disintegrate. Next is skeletonization, last stage. Skeletonization is the last stage of putrefaction when the body is reduced to a bare skeleton. Silent features. Time required varies considerably. Body lying exposed in air, carnivores, dogs, jackals, vultures, flies, and their larvae, maggots, insects, ants, cockroaches, and rodents reduces body to a skeleton within a few days. Body in water. Body attacked by aquatic animals. Crabs, fishes, clothing protect from body from animals for long period. In warm weather, algae may deposit on exposed part of the body. For a clothing in warm weather, algae may deposit on exposed part of body, offering some protection against aquatic animals. Buried body factors affect modifying rate of skeletonization, access to air, acidity of soil and soil water, amount of soil water, climate and seasonal variation. Body buried without coffin. In shallow grave, putrefaction delayed to moderate extent. In a deep grave, decomposition is markedly delayed due to decrease in temperature, exclusion of air, absence of animal life. Mass burial in a common grave, body lying in the center of a grave, are better preserved than those at the periphery. Average time period for complete skeletonization of buried body in India in 1 year. Body buried within coffin. If a coffin is a good quality and airtight, disintegrate does not completely till several decades. Poor quality coffin which admits air and water, body may decompose within 1 month. Bones lying on surface. As proteinaceous portion decomposes, bones are reduced to just calcium, which then crumble. Bones which decomposes faster. Flat bones of infants and old. Buried bones decay or according to acidity of soil. Neutral soil does not destroy bones. Acidic soil causes decay in 25 to 100 years depending upon the acidity. Condition affecting the rate of putrefaction. External air. In normal condition, unbroken skin acts as an impermeable membrane to barrier to bacteria. Free access to air hastens putrefaction. Air conveys organism to the body. Most air hastens putrefaction. Clothing. Loose clothing initially. Putrefaction increases because body temperature is maintained and is not allowed to fall. Later, decrease in putrefaction because access of airborne organism, flies, insects is prevented. Tight clothing includes belt, boots, socks, suspenders, and undergarment tight fitting. Initial and later changes both decreases putrefaction, tissue compressor, and blood driven out. Organism do not find a media to grow. Also, access to organism is prevented as above. Manner of burial. Putrefaction is less. Body buried soon after death. Buried in dry soil, buried in sandy soil, buried in lime, buried deeper than 2 meters. Body covered and placed in coffin, exclusion of water, air, and action of insect. Putrefaction is rapid. Body buried late after death when putrefaction process already started. Buried in damp, marshy, and porous soil. Buried in soil with excess of clay and in acid-peaty soils. Even bones may be destroyed. Buried in shallow grave, less than 2 meters, buried without clothes or coffin. Moisture. Moisture is necessary for the putrefaction. Condition associated with increased moisture, increased rate of putrefaction. Anasarca, body recovered from water. Organs which contain more water putrefy faster. Rapid drying of body inhibits or even arrests it. Thus, the putrefaction is low in dehydration, death associated with the vomiting and diarrhea, irritant like arsenic and antimony, organ with low water content. Prostate, virgin uterus, bones are the last organs to putrefy because their water content is minimal. Temperature. Putrefaction begins at a minus 10 degrees Celsius. 10 degrees Celsius. Temperature increases at 10 degrees Celsius, doubles the rate of all chemical reaction, including putrefaction. Season rate of putrefaction is twice in summer as in winter. Putrefaction is optimum between minus 21 degrees Celsius minus 30 degrees. Putrefaction is arrested less than 0 degrees Celsius and more than 48 degrees Celsius. Dead bodies are best preserved at 4 degrees Celsius. Tissue water level increase in volume decreased as 4 degrees Celsius, causing cellular breakdown, which in turn hastens putrefaction due to release of protein and water. If putrefaction has already started, lowering the temperature does not help. A bacteria enzyme already released continues to act. Variation in the same body. All parts of the body may not be in the same stage of putrefaction because of different temperature. Pillows over the head or blanket over the body may increase the temperature of areas, increasing the rate of putrefaction locally, while other areas of body may putrefy less rapidly. Better air circulation over one part of the body may tend to carry away heat faster, preserving that part. Internal. Newborns in unfed slow because body is sterile. If fed fast, if IV drips etc. were given fast because bacteria can enter quickly through punctures. Bodies of children putrefy faster than those of older people. Less water content. Sex no effect on putrefaction. Condition of the body. Flat and flabby bodies putrefy faster. Increased fat and fluid. Increased retention of heat. Cause of death. Putrefaction is a rapid death due to anasarca, asphyxia, inflammatory condition, peritonitis, septicemia. In case of generalized sepsis, bodies undergo rapid decomposition, even if they were immediately refrigerated. In infection due to Clostridium welchii, acute intestinal obstruction, pus gangrene, septic abortion, putrefaction is particularly speedy. Putrefaction is delayed in death due to anemia, debility, wasting disease. Poison which either have a preservative actions on tissues or a destructive action on a bacteria on both. Poison which delayed putrefaction, carbolic acid, heavy metal poisoning, chronic, especially arsenic. Strychnine if death occurred following a feverish seizure. Zinc chloride, this should be not confused with the poison which resist putrefaction, which are not destroyed by putrefaction, can be detected even in putrefied bodies. Poison which resist putrefaction, barbiturate, corrosive, cyanide, datura, potassium cyanide, metal, nicotine, pancuronium, organophosphate, phosphorus, strychnine. Case studies. Efrain Saldier, an American respiratory therapist, used it to kill his patient by injecting pancuronium. 20 of his patients were exhumed. 6 showed lethal concentration of pavulon. He pleaded guilty in 2002, received a 6 consecutive life sentence. Heavy metals and strychnine both delay and resist putrefaction. Cyanide both appears after and resist putrefaction. Poison which are destroyed by putrefaction, aconitine, morphine, succinylcholine. Poison which hasten putrefaction, chronic alcoholism, hydrogen sulfide, strychnine if death occurred after prolonged and repeated seizure, increased heat production. Poison which appear due to putrefaction, alcohol, bacterial and fungal ferment yield ethyl alcohol, which may violate the interpretation of postmortem alcohol concentration. Level of alcohol produced by putrefaction are almost always less than 200 milligram percentage. Carbon monoxide, cyanide, tomains. Substitute a phenol, especially para-hydroxyphenyl derivative. Mutilation. Mutilated bodies or bodies with excessive wound or rapid putrefaction. Organism gain easy excess dismemberment. Putrefaction of limbs is lower than that of trunk. Blood drains out of limbs. Intestinal organs cannot gain access. Castor dictum. Casper's law, Regal Casper's rule states that time taken for same amount of putrefaction to occur when the body is in air, water and buried in earth is the ratio of 1:2:8. Air 1 2 water buried in earth 8. Putrefaction occurs fastest in air and slowest in earth. In water and earth, atmosphere is not available for putrefaction. In water, moisture causes faster putrefaction than when body is in earth. AWE. Air, water, earth. Okay. Medical legal aspects of putrefaction. Time of death can be ascertained. Cause of death becomes difficult to ascertain except in cases of firearm injury, fracture, drowning, and poisoning. Hair, teeth, bones resist putrefaction, and several poisons, especially metals, can be detected in hair and bones. Several points may resist putrefaction. Diatoms may be demonstrated in bone. Infanticide level of diaphragm may be seriously be altered by gases of decomposition. Poison can hasten or delay putrefaction, can resist putrefaction, may destroy during putrefaction, may appear after putrefaction. Defense lawyer may argue that poison appeared due to putrefaction. Rygar's test may be vitiated by putrefaction. Thank you.